folks, and welcome to our presentation on microbial diseases of the genital and urinary tract. Today we're going to be kicking off our discussion about these diseases by talking about trichomoniasis, or trich for short. Now, the cause of this agent is Trichomoniasis vaginalis. This parasitic protozoan is about the same size as a white blood cell, and it has a couple of important structures that I'd like to mention. First, it has 4 flagella on its anterior side, a nucleus, and an axostyle. I'll be going into more detail about the axostyle on the following slide. But first, it's important to point out that trich is mainly found in the vagina, cervix, urethra, and bladder in females, whereas in males it's found in the anterior urethra, external genitalia, prostate gland, and the epididymis and semen. But how does it get there? In short, it happens through intercourse between somebody who is infected with trich and somebody who is not infected with it. With this, the parasite has the opportunity to cross from one mucous membrane to another mucous membrane. Once inside the newly infected person, trich destroys epithelial cells by attaching directly to them through the axostyle. As promised, the axostyle is something that the parasite uses in order to attach itself directly to the cells and then release cytotoxins into the cell. All the while, trich is able to move throughout the mucous membrane and through the lumen by using its 4 flagellum, and it's able to multiply through binary fission. In this image, it slightly portrays it as a cycle. That said, once it goes through this one cycle, it is then able to be passed on from one person to another. Which leads us to our symptoms. Now, a lot of the symptoms are pretty similar to other UTIs or STIs, but they're still very important when talking about diagnoses. So that said, females will often notice a thin-colored or foul-smelling discharge, redness, itching, burning, painful urination or painful intercourse, or just general discomfort in the lower stomach. Males, on the other hand, will have an itching or irritated sensation that is described as coming from inside the penis, all while having burning urination or ejaculation and discharge like we saw in females. However, what's crazy about trich, in my opinion, is that only 30% of cases will show symptoms according to the CDC. And because only 30% of cases show symptoms, diagnosing trich can be a bit difficult at times. So if you were to go to a doctor wondering if you have trich or not, the first step would be doing a general examination. General examination would include answering questions like, is there discharge? Is there redness? Do you have pain with urination? So on and so forth. And if the answer to the question is yes in any of these, the doctor would then take a swab of the potentially infected area or take fluid from the discharge or urine samples. From that sample, they would then put it under a microscope, and if they see that trich is present, then you have trich. However, for the 70% of people who don't have symptoms, but are still concerned that they may have contracted trich from somebody else, rapid antigen testing, or nucleic acid amplification tests, NATT for short, are also able to be used to determine whether trich is present or not. Now, according to researchers, trich is possibly one of the largest scale infections across the world. Approximately 220 million cases are estimated to be global, according to the WHO. Now, this number can be easily debated because only 30% of people show symptoms, so whether or not there's actually 220 million cases for an STI isn't really known. Nevertheless, the U.S. noted that there was 2.6 million cases of trich in 2018. Regardless, those who participate in high-risk sex are most susceptible to trich infections. High-risk sex can be defined as those who don't wear protection while having sex, those who have multiple partners, those who have intercourse with somebody who isn't infected. Moreover, across the range of people who are infected, it was realized that females are the ones who are primarily affected from trich. Researchers were then able to conclude that of the females that were affected, most of them were over the age of 30. In addition, the CDC noted that trich is also associated with lower socioeconomic classes. Despite so many people being infected with trich, there are many treatment options that somebody can choose from to combat the parasitic infection. One can take metronidazole, tinidazole in small doses over a week's time, or as the Mayo Clinic perfectly termed, a megadose, which includes the two same drugs listed above, but also sectinidazole. The megadoses are typically about 1,000 milligrams of antibiotic via an injection. Despite the multiple options that we have, scientists have found that the most effective one at curing a person from trich is the metronidazole over multiple doses. This is, of course, assuming that the person finishes the antibiotic and their partner actually gets treated with the antibiotic. It was found that 95% of cases did not have a relapse in trich if these criteria were met. Having learned all this, though, I was still curious as to what would happen if somebody who has had trich never got treated for it. And what I learned was pretty shocking. Both males and females who have trich but don't get treated for it are more likely to contract or pass HIV, whereas males are more likely to have an increased chance for epididymitis, prostatitis, and infertility, whereas females are more likely to have a premature birth or have an increased chance for further infections outside of just trich. And this leads us to chlamydia. Chlamydia tracheomatosis is a small gram-negative obligate intracellular microorganism. It infects the cervix, urethra, uterus, nasopharynx, and epididymis in males specifically. It also has the ability to infect the eye. However, this is outside the main scope of this presentation. Nevertheless, it is the most common and most reported STI in the United States. The mechanisms in which somebody can be infected with chlamydia is through intercourse with somebody who is also infected with chlamydia. Neonatal contact or hand-to-eye contact. Neonatal contact occurs when an infant is exposed to chlamydia in the womb and birth canal. This will often lead to chlamydia conjunctivitis, which is chlamydia around the eyes. Whereas you can also get chlamydia conjunctivitis by also touching an infected area and then subsequently touching your eyes. Regardless, chlamydia has the same way of reproducing. As mentioned before, this is an intracellular bacteria. That said, the bacteria primarily reproduces inside a host cells. It's kind of similar to a virus. The bacteria attaches itself to the host cell wall, tricks the cell into letting it in, steals energy from the cell, creates multiple copies of itself, and then escapes the cell, ready to infect more cells. Which again leads us to a list of symptoms. And as noted before, these symptoms may look familiar. They include discharge, discomfort, pain with urination, bleeding between periods for females, and again discharge, dysuria, and testicular pain for males. In cases of chlamydia conjunctivitis, you will have goopiness around the eyes and can lead to potential blindness. And similarly to trich, one can diagnose chlamydia by doing a urine test or taking a swab of a potentially infected area, checking under a microscope. If it's there, you do in fact have chlamydia. Here we have a graph that was made in 2020 by the CDC, which depicts an age range of those who are primarily diagnosed with having chlamydia. As it can be observed, those who tend to have it tend to be much younger, roughly around college age. And that is why you also will be seeing a lot of chlamydia outbreaks on college campuses. In fact, my college actually had a small outbreak of chlamydia during my freshman year. Nevertheless, those who are most susceptible are females, those who don't wear condoms, those who have multiple partners, and those in low socioeconomic classes. And of course, those who have intercourse with those who are already infected. Again, there are a multitude of treatment options available for those who have chlamydia. However, it has been observed that by researchers that azithromycin is the most efficient and effective at curing people. This is performed in a single 100 milligram oral dose. However, if complications such as a person being pregnant, being allergic to the drug, or if a person has been untreated for a long duration of time, other antibiotics may be better options for an individual. Those antibiotics are listed on the right. And this leads us to our final disease of the day, syphilis. Syphilis is caused by Treponema pallidum. Oh, sorry, let me say that again. Treponema pallidum. My apologies. This long, slender spirochete is a gram-negative bacteria. It is unable to live outside the body for long periods of time, so it can only be contracted through direct contact. As previously mentioned, this is a spirochete. That means that the syphilis has a cool literal and metaphorical twist to its cell wall structure. As observed in the image, one can see a traditional gram-negative bacteria cell wall in the uppermost image. However, you can also notice the differences between the spirochetes and normal gram-negative bacteria. One difference is the presence of lipoproteins, which aid in the adherence to body tissues, and the flagella that appears in the periplasmic space. This aids in motility of the bacteria, allowing it to corkscrew and move. These structures ultimately allow it to travel across multiple mucous membranes through epithelial tissue and adhere to surfaces as well. All said, one can contract syphilis through contact with a lesion via intercourse or a crack in the skin, blood, or neonatal contact. In the case of neonatal contact, the infant will likely be infected with what is called congenital syphilis. This occurs through syphilis crossing the placental barrier and directly affecting the newborn. More information on this will come. Nevertheless, syphilis has an incubation time of which will last about 10 to 90 days up until primary symptoms are first observed in the non-congenital cases. And this leads us to congenital syphilis. Now, I realize that I've kept pictures of infected areas out of this presentation. However, there will be a picture that will appear on the slide that includes a child's face that is infected with congenital syphilis. If this bothers you, this is your warning. And with that out of the way, for children who are infected with congenital syphilis, many are stillbirths, meaning that they die in the womb or soon after being birthed. However, for infants that do not pass away in the womb, signs and symptoms may include scuffs, which are lesions seen on the child's face, saddle nose, which is a deformity of the skeletal structures of the nose and the surrounding areas, Hutchinson's teeth, which are spaced out incisors that are pointy in shape, and saber shins, which is a deformation of the tibial bones. In non-congenital cases, however, signs and symptoms occur in stages. After being infected and having the incubation period, primary symptoms of syphilis, such as chancre, will appear in the areas that were exposed to the infection. Chancre sores will typically last for 6 to 10 weeks, and after this, the lesions will then heal, and rashy spots will begin to appear throughout the body. This can last upwards of a year. After these symptoms fade, it will appear that the infection has stopped. This is called latent syphilis. In this stage, syphilis can appear to lay dormant up to 10 years. However, it's during this stage that syphilis is spread throughout the body. For about 75% of people who progress through latent stage syphilis, they won't experience any further symptoms or complications. However, for the other 25% who go through latent syphilis, will begin to have tertiary stage symptoms. This will include cardiovascular syphilis, gumas, which are intensified lesions that can form into ulcers, affecting the liver, bones, and testicles. And other forms of neurosyphilis can occur as well. It should be mentioned that neurosyphilis can actually occur at any point during syphilis infection. So if any symptoms of neurosyphilis, you should talk to a doctor right away. Nevertheless, tertiary stage symptoms can be lethal. So how does one get diagnosed? The primary option occurs through blood sampling. If syphilis is found in a person's blood, then it's clear that they have syphilis. And it has been found that syphilis can be found in the blood only 30 minutes after being infected, which is very fast. However, that was only found in rabbit tests. So we are uncertain as to how that plays into humans. Nevertheless, it can be found in blood. Another way that you can test for syphilis and this is only in the case of suspected neurosyphilis. Doctors can do a lumbar puncture, draw cerebrospinal fluid, and test for the presence of syphilis through cerebrospinal fluid VDRL testing. In 2019, there were approximately 133,000 cases of syphilis in the United States. This graph made by the CDC depicts how these 133,000 cases were divided amongst various populations. That said, according to the CDC, those who contract the most amount of cases are males who have sex with males, followed by females, males with unknown partners, and then males who have sex with females. Moreover, it is also noted that those who participate in high-risk sex, again, are also more likely to contract diseases according to researchers. Despite how serious syphilis conditions may be, penicillin is very effective at treating it in earlier stages of the infection and in some congenital cases. However, it is when the infection progresses beyond the latent stage into the tertiary stage that treatment becomes more difficult. It's likely that somebody will have to go through weeks of penicillin injections or taking an alternative drug of multiple doses of doxycycline. However, penicillin is still preferred among specialists, and again, if complications such as pregnancy are in play, other drugs are available. And with that, we will be concluding our discussion of microbial diseases of the genital and urinary tract. Thank you so much for listening today, and stay safe.